I want to talk to you about the 4 most common injuries associated with the sport of pickleball. If you guys don't know me, my name's Tony Maritato. I'm a licensed physical therapist here in Middletown, Ohio, and I get to work with a lot of adults who are passionate about playing pickleball. So Baylor College of Medicine recently published an article talking about the most common injuries associated with pickleball, and they identified rotator cuff injuries as being number 1. So the rotator cuff, if you don't know, it's a series of 4 muscles and the associated tendons that are inside the shoulder. They're the small kind of controlling muscles that control the head of the humerus and help you manage movement through the shoulder. So common injuries include rotator cuff tears. There could be a full rupture, full thickness tear, partial thickness tear. There could be just inflammation in the rotator cuff tendons. Certainly shoulder bursitis is a common issue, or just generally shoulder arthritis. Other common injuries associated with pickleball include meniscus tears. So the meniscus is a C-shaped piece of cartilage that sits inside the knee joint. It actually sits between the femur and the tibia. What it is it's thickest on the outside edges of the knee and tapers down. It helps to improve the surface area contact of the bones and provide some shock absorption. But a common mechanism of damaging the meniscus is when you're playing pickleball and you have an aggressive kind of stop and twist motion. That's kind of textbook. That's how you tear the meniscus. So number 1 is rotator cuff injuries. Number 2 is meniscus tears. Number 3 are just generalized tendon ruptures. And because pickleball is one of those sports where it's kind of quick acceleration and deceleration, it's not uncommon that I would hear of a patient who ruptures an Achilles tendon. Usually the Achilles tendon will rupture if you're going backward and you suddenly stop. It's most often described as somebody who hears a loud popping sound. Maybe they think that they got hit in the lower leg with a ball or a bat. But that's usually what people will say when they experience an Achilles tendon rupture. You can rupture any of the tendons in the body, but that's a common one. And then finally, the 4th most common injury is really just the aggravation of existing osteoarthritis. So osteoarthritis is characterized as degenerative changes in the joint surfaces, the cartilage that covers the bone. It could be just general wear and tear. It could be damage from traumatic injuries like a car accident or falling off a ladder. And what happens is, as you increase your pickleball playing intensity, playing time, you start to aggravate those joint surfaces and you don't give them enough time to recover on their own. There is a ton of information on the Pickleball 5000 website about how to recover. If you focus on your recovery, it is going to allow you to play more frequently, more intensely, and it's going to allow you to get better at the sport. But if you have any specific questions about pickleball related injuries, please don't hesitate. Post your questions down in the comments below and I'll see you on the next video.